Diabetic ketoacidosis. Insulin helps the glucose that's in the blood to come into the cell and be used for energy. Sometimes there's not enough insulin in the body, and so the body is unable to use that glucose for energy. The body then resorts to an alternative form of energy, and it starts to break down fats. Now, when the body starts breaking down fats, it produces something called ketones. So essentially, the ketones that are produced from fat using as an energy source causes acidity in the body. Possible causes. Patient may miss their insulin doses, and so there's not enough insulin for the body to use in processing that glucose for energy. Illness or infection, which just puts the body under a lot of stress, undiagnosed diabetes, or a patient with untreated diabetes, signs and symptoms to watch for on your next exam. Extremely high blood sugar levels, anywhere from 300 to 800 milligrams per deciliter. Those ketones being dumped into the body will cause ketonuria. So when we test the urine, we see a high level of ketones, and also metabolic acidosis in the blood. Due to all that blood sugar in the bloodstream, the body tries to excrete some of it in the urine. So these patients experience a lot of polyuria, which then leads to a lot of fluid loss and dehydration, nausea, vomiting, and abdominal pain. And with this can lead to a weak and thready pulse. The patient might have a fruity odor, also known as acetone breath. Also see altered mental status and blurred vision. What's your job as the nurse? You will find that a lot of these patients will not be on a medical surgical unit. They're typically transferred to the ICU because they need very close monitoring. Monitoring the level of consciousness, the general vital signs, and also their intake and output. So you might see them on infusion to encourage hydration and replace all the fluid loss that had already occurred. The patient will also have an insulin infusion, checking their blood sugar every hour, depending on the patient's condition. Whenever the blood sugar becomes stable, the patient will then resume receiving insulin through the subcutaneous route. In regards to acidosis, the patient's acid-base balance will be monitored frequently, including something called an anion gap. If you end up working in the ICU, make sure that you ask about that. Electrolyte balance is also monitored during this period, especially the potassium. Can you tell me why potassium is usually low in patients with DKA? Leave me your answer in the comments below. I hope that this helps you understand diabetic ketoacidosis a little bit better. Make sure that you share this video with a nursing student who needs to get this topic a little bit easier. This concludes the end of the endocrine system on this page. So tell me what system you want to delve into next so we can start talking about it. Until next time, have a good day. Bye-bye.